Dr. Redfield, welcome.
Good morning, Chairman Alexander and Ranking Member Murray and members of the committee. Our nation is confronting the most serious public health crisis in more than a century. Yet we're not defenseless. We have powerful tools to fight this enemy. We have tried and true effective public health interventions, such as early case identification, isolation, and contact tracing, combined with important mitigation strategies to include social distancing, frequent hand washing, and face covering. These public health tools have and will continue to slow the spread of COVID-19. I appreciate the opportunity this morning to provide a brief overview of some of CDC's ongoing work in response to COVID-19. CDC has been working 24/7 to combat the pandemic. CDC's Emergency Operations Center is supporting state, tribal, local, and territorial public health partners in building core capabilities, particularly workforce, laboratory, and data and predictive analytics. Epidemiologists are conducting surveillance for COVID-19 as well as conducting health system surveillance. Community mitigation teams are providing guidance on infection control and contact tracing.
Please remain indoors. This is for your own protection.
And our laboratory experts are performing serological testing to better define the extent of asymptomatic populations. As local leadership makes decisions to reopen, they'll require varying degrees of federal support. Each location will be different and will face unique circumstances. CDC has conducted a state-by-state assessment of public health testing capacity and contact tracing capacity, as well as surge plans. CDC is providing technical assistance and funding to the states provided through the Supplemental CARES Act and the Paycheck Protection Program and Healthcare Enhancement Act. We're working directly with the state public health leaders to define their needs for testing and testing devices, supplies, and manpower, surveillance, data collection and reporting, contact tracing, infection control, and outbreak investigation.
All up in my goodies.
I want to spend a moment to focus on several key elements. First, testing. Rapid, extensive, and widely available timely testing is essential for reopening America.
The guy with the rubber glove was surprisingly gentle.
CDC's role in testing continues to support diagnosis and contact tracing, surveillance, and outbreak. And we work with the public health partners to define their particular testing strategy for their jurisdiction. Admiral Gerard will address the testing components of the response in greater detail. Contact tracing. Increasing state, tribal, local, and territorial contact tracing capacity is critical. It's a critical part to stop the chains of transmission and prevent the occurrence of sustained community transmission. CDC's role is to provide technical training, assistance, and support to the states as they hire and build a workforce necessary to be fully prepared to effectively respond to the public health challenges posed by the ongoing COVID pandemic. This will be an expansive effort. Surveillance. Our nation's surveillance program is built on a combination of systems, including existing syndromic, influenza, and respiratory viral disease surveillance systems that have been combined with commercial and research lab platforms and our case reporting form system. CDC is adapting these and optimizing it to have a surveillance system in response to COVID-19. Importantly, in light of the significant occurrence of asymptomatic infection, the surveillance for asymptomatic infection becomes an important public health tool for early case identification. CDC is working with each public health jurisdiction to develop a prospective surveillance program to include active surveillance among those that are most vulnerable, such as individuals in long-term care facilities, inner-city clinics, and homeless shelters. We need to rebuild our nation's public health infrastructure. Data and data analytics, public health laboratory resilience, and our nation's public health workforce. Now's the time to put it in place for the generations to come, not only for the public health system that our nation needs, but for the public health system that our nation deserves.
Get the fuck out of here.
Before I close, I want to recognize the tireless commitment of the dedicated CDC staff who've deployed to every corner of this nation to fight COVID-19. More than 4,000 employees have deployed here and globally. Science and data continue with technical expertise and public service to be the backbone of CDC's contributions to the U.S. response.
I am now a child of light. Your earthly money holds no appeal to me.
$20,000.